Welcome back to Millennial Mental Health channel. We are here to talk about the mental health, and here is your co-host, the Bavarian burrito himself, Mr. Eddie Carrillo.
What the fuck is Bavarian?
It's a part of Germany, I believe.
Okay.
Yeah.
Oh,
Sorry, that was one of my more obscure accents.
you know I don't know a lot of things, so like to throw out something like that, I'm just like, what is happening?
I like to throw you off guard, because it's fun. It's fun to get a laugh out of you and start off on a weird foot.
I'll take that. Well, we're back. We got another episode. I was thinking on the car ride home from work that it sounds weird to say. I'll just say the topic for today, September, if you don't know, is National Suicide Prevention Awareness Month. And as I was driving home, I thought, I think I'm excited for today's episode, and not because it's like a jovial, like we're gonna crack a bunch of jokes like type episode. I think I'm looking forward and excited to just kind of talk about it and hopefully make it a lot less like scary to talk about, or even just a little bit less scary to talk about, because I think a lot of people, and for me for a long time, even when I was like on the crisis team talking with people who were like experiencing suicidal ideation, the word suicide like would almost make like the hairs on the back of my neck stand up, or like I would just cringe a little bit, because it's like the scary word, the big scary word. So I'm looking forward to talking about it today, just to kind of add some more information out there. We'll give our whole spiel here in a little bit, but I'm glad we're here. I'm glad we can talk about it. I'm glad we have this opportunity, this platform where we can talk about this kind of stuff. So I'm excited for it today.
Me too. Yeah, I feel you. When I first started medical school and I was on my psychiatry rotation, like I remember even having a hard time saying the word suicide, especially in front of a patient too. Mm-hmm. And now as mental health providers, we both deal with this so often. It is second nature to us now. So I'm hoping that by the end of this, we all feel a little bit more comfortable thinking about it, talking about it, because ignoring it and avoiding it doesn't really help.
Yeah.
And doesn't really address any of the problems. It's important to be able to speak about it, talk about it, figure it out a little bit. So that's why we're here today.
Yeah, I'll even be a little vulnerable here. At the beginning of my career talking about it, I would do like the screenings, and I would just be like, so are you having like concerning thoughts? Like I would just like dance around it, because I'm like, this feels so uncomfortable. And in the beginning, it's like if I say the word, which we'll probably talk about at some point, but I thought if I say the word, it's just going to make things worse. Really, for a lot of people, I think I can just speak like anecdotally, or even like there's evidence behind it. But for some people, it's almost like a relief when you bring it up of like, oh, thank God, like somebody else can say it, because if I say it myself, like that's just too hard. So to normalize it a little bit, even for people who do this for a living, Justin and I, still at some point was pretty hard to just say the word, say the phrase.
Yeah, and overall it is still a very stigmatized word. I think a big example of this is back when I was making TikTok videos. You can't actually say the word suicide in TikTok. Like you have to, especially in the captions, like people when talking about mental health, they had to say sewer slide.
Oh yeah.
Instead of suicide, to try and beat the whatever walls there were to prevent that from. But that just goes to show you how people aren't allowed to talk about it a lot of times in society, which is so interesting.
Yeah. You got any shout outs for us today, Justin?
This is kind of a more serious topic, but I really wanted to shout out Squirt Cola or Squirt Soda. Eddie and I were talking about this before we started recording. I had no idea that Mexicans love Squirt. This was news to me, but I'm way into it. I'm gonna go buy a pack of Squirt, because
the more you know.
The more you know. Knowledge is power, and that is some powerful knowledge.
I'm gonna have like a family member that's gonna listen to this episode, and they'll be like, "Yeah, we do like Squirt."
Lifelong fans forever since we shouted out Squirt.
Is Squirt a cola product or is it Pepsi?
I think it actually might be its own thing. I don't know.
Oh.
This might have to be a Google search. Who owns Squirt? Dr. Pepper Snapple Group.
Oh, there you go.
Left field. I had no
The
idea.
more you know. Again.
The more you know.
Well, we hope that tidbit of knowledge is helpful. We hope the rest of the episode is helpful. I'll start us off. As I was writing the notes for today, I was like, man, we haven't talked about this in a long time. And actually, when I went back and looked at our extensive catalog of episodes, which actually is going to hit 100 here in the next month or so, less than a month, we talked about suicide 3 years ago this week. And I think we did it to coincide with like National Suicide Awareness Day, with the whole month. So it's been a long time. We've done basically like redo episodes recently. So we just thought this is a good opportunity to do it. We're coming up on 4 years. We're coming up on 100 episodes. Why not? So from SAMHSA, we'll give you a little bit of information from the specific mental health and substance use bodies that help spread correct information. SAMHSA is the Substance Abuse and Mental Health Services Administration. They define Suicide Prevention Month as a month to remember the lives lost to suicide, the millions of people who have struggled with suicidal ideation, and to acknowledge the individuals, families, and communities that have been impacted. And if you learned anything from us with the show, or just us sharing about our career, a lot of people have been impacted by suicide. We talked about Angus Cloud recently, potentially passing away from suicide. So it's something that comes up quite often. It's also a time to raise awareness about suicide prevention and share messages of hope. Suicidal ideation, they don't discriminate. Anyone can struggle with this, but it's also really important to remember that anyone can support those who struggle. Like, we all have an opportunity to be a support person. We don't necessarily need to be an expert. Research has shown that people who are having thoughts of suicide actually feel relief when someone asks them about their thoughts in a caring way. And actually, I think I mentioned it on the show before, Justin, but I did this training for mental health first aid, and specifically youth mental health first aid. And really, if I were to sum it up in as quickly as possible, because it is a 6.5 hour long training, it is long. If I could sum it up as quickly as possible, it's basically, the training is to teach those who come in contact with youth, whether you're a teacher, a school staff, you work in a mall, I'm having a hard time thinking of jobs where you come in contact with the teen, but you come in contact with the teen. It's basically a training to help give you the skills and knowledge to know, like, how can I help someone who's struggling? How can I help somebody who feels like they might be a danger to themselves? And how can I get them connected to the right resources right away? So really, it's just important that we share this information as much as possible. Our hope is, maybe you never have to use some of this knowledge. Maybe you go through the rest of your life not having to. But if you do, if in the chance that you do have to step in and help somebody, we just hope that you feel at least a little bit better equipped.
Yeah, I think one of the things I've learned too in my life and my job as a psychiatrist is that a lot of people have suicidal thoughts. And it's not a rare thing, but because there is so much societal stigma around it, people are really afraid to open up about it, talk about it. And once I tell my patients all the time, like, in a way, it's totally normal to have these thoughts. You're under a lot of stress, you're depressed. It sometimes can seem like a legitimate option to end your pain and suffering. I think a lot of people in your position would have those same thoughts. So even though it's something we don't want to happen, in a way, it's very normal. Lots of people have suicidal thoughts. Like, you shouldn't feel like bad, or shouldn't feel like, oh, I shouldn't be having these thoughts. Like, it's a normal thing.
Yeah.
So as we move through this episode, did you have anything? Okay.
You good? Yeah.
So as we move through this episode, there's something that we want to mention, and something that we mentioned the last time we covered this topic. It's very critical that we remember the importance of knowing when to leave something to the professionals. I see this a lot of the time. People on social media being like, hey, my DMs are open, or I would rather hear your story than be at your funeral, and other things like that. And as a mental health professional, I really do appreciate it. To me, it helps me to normalize and destigmatize mental health. And something that this young generation is doing a really great job of is destigmatizing. But I talk to a lot of young people, and when I'm talking suicide safety plan, and I say, hey, if you're having suicidal thoughts, like, who would you go to? They're like, oh, my best friend Ricky.
Yeah.
And I'm like, don't go to Ricky. Ricky is
Yeah.
not a trusted adult. I don't trust Ricky. You should go to someone who's more responsible and like. So like, yes, I'm glad that we're talking about this. And so many young people that I talk to, their friends are the biggest support system. But it's important to leave things to professionals and maybe even trusted adults.
Mm-hmm. Yeah, even when we do, like at work, we'll do like safety screenings, and we'll come up with like a support plan for students. On it, the three first questions for the support plan are: who's an adult at home that you can talk to if you're starting to feel unsafe? The next one is: who's an adult at school that you can talk to?
Yeah.
And then the third one is like: who's a friend that you can talk to? So it is important, like you're saying, it is important to have those friends you can talk to, but it's also very important to know like you should talk to a trusted adult and someone that can maybe has more of an ability to help. I think too, more to your point, Justin, of like knowing when to leave stuff to the professional. It's also just really hard to talk about suicide and suicidal ideation. When I was on the crisis team in my first job, like there'd be days I would get home and my brain felt like mush. Like I just like could not think, couldn't put together a sentence. Like it was tough. It is hard. And that's me like having years of training and experience. So like for people who are not used to it, like it's just important to know it's really hard. It can be really tough. You don't want to have that extra added pressure if you don't need to. I think we can acknowledge that there might be a situation at some point where like you're really like in the thick of it, maybe helping somebody out. But just know, like if there's ever an opportunity to get a professional involved, an adult involved, like please try to lean towards that. We'll have some stuff later in the episode and in the show notes as far as like resources, places you can turn to, but really it's just important to know like thank you for all you're doing, listeners who are trying to make suicidal ideation feel more normalized, because like Justin said, it basically is normal to have these thoughts, and it's something that comes up a lot. But also just to know like when and where to get a professional or just an adult to come in and step in and help out.
Yeah. And I know we did shout outs at the beginning, but shout out to all the healthcare providers and anyone out there who's working in mental health, because you are helping. You are trying to reduce the stigma. And a big shout out to Lindsay Simino, who is our friend of the show, has been on the show a couple of times, who actually did a lot of lobbying and political work to get the 988 suicide hotline funded in Wyoming. So there's a lot of people doing a lot of good work. I know Imagine Zero. I just moved to Weld County, Colorado, and they're a whole organization down here that is trying to reduce and end suicide. And so there's people trying to get this moving, because it's a big problem.
Yeah, I'm actually on one of the county like committees for like the Suicide Prevention Council, and we get to hear about different community stakeholders that are working on different projects to try to help out, which I think is really cool. One project that I heard about that I thought was super cool was a county that trying to make information more readily available. So they made a bunch of hot coffee sleeves that had like words of encouragement and then like 988 on the back, so like coffee shops could just use them like normal, something you'd pick up any way if you went to Starbucks or whatever it was, and now you're spreading some information to people. And I'll toot my own horn, maybe not my own horn, but like our school's own horn. But our mental health club right now is working on a project where we're going to have like a mental health corner that has resources in the school. I think we're going to lean towards like QR codes and stuff where kids can just walk by, get any kind of information they need, and because the school's brand new, add a little bit of character to the school. But I'm excited about it. I mean, anytime you can spread information, make it more accessible for people, I think you just have a better chance of people getting help when they normally wouldn't.
Cool. I like it. Yeah. I like all that information for the students there too. That's a great program.
Yeah.
Well, let's jump into some stats and facts. So recently, suicide has been anywhere from the 10th to 12th leading cause of death in the United States. According to the CDC, the 2022 and 2023 data we have so far is still provisional, but about globally, about 1 million people die per year by suicide.
Yeah. Remembering that the data in 2022 is still provisional, right now the data is showing that overall the number of deaths by suicide has increased by about 2.6% from 2021 to 2022. But something interesting that one of the website wanted us to note was just that it's also decreased among American Indian and Alaska Native people and youth. So something to consider. I think I was looking at the charts, And there was a couple groups where I can't remember it all off the top of my head, where it actually was decreasing, like the numbers were lower. There could be a number of things why that's happening. Statistics can be manipulated, but I think just something important to know that we don't want it to be all doom and gloom. There are things that are improving. I would even be willing to say that over the next few years there's an opportunity for the way our kids and teens are, that they're going to help to reduce numbers even more, just because of how supportive I think this next generation is, how well informed they are, how willing they are to seek help. I think us as millennials, they started to kind of get help and therapy and support as much as possible, and I really think that's been starting to pass down to the next generation. So I think we have an opportunity to, once the impacts of COVID have kind of, it's still a thing, but once we've started to get back into like a normal swing of things for kids, or development is starting to go back in the correct direction, I think there's an opportunity for things to improve even more.
I hope so, because we definitely are in that mental health crisis post-COVID. And yeah, the numbers are unfortunately going up, especially in young women too. Is what we're seeing a lot of. But suicide was the second leading cause of death among individuals between the ages of 10 and 14 and 25 to 34. The third leading cause of death among individuals between ages 15 and 24. And the fourth leading cause of death among individuals between 35 and 44. And although more women than men attempt to die by suicide, more men are 4 times more likely to die by suicide, and that's typically because men use more lethal means.
And by lethal, we mean something that is like more likely to take your life. I've heard of instances where teens will say they're like, they'll cut themselves, or they'll do certain things that like there's a potential that something dangerous can happen, but it's far less likely than using something like a firearm, I think is what a lot of the statistics are showing. Another risk factor for suicide and suicidal ideation is childhood trauma. We've talked about the ACEs before, so the adverse childhood experiences. Trauma is like the thing. I think at some point there's going to be a DSM that just is like, it's just going to say the word trauma, and then it'll just have like every single disorder right after. Because I think a lot of people are willing to make that statement that trauma basically causes a number of our mental health disorders, or it's a cause for it. Not the only cause, but it's part of it. Sexual trauma has the highest increase of someone's potential or risk factor that they die by suicide. And then other forms of trauma tend to raise anxiety, which also increases the risk for suicide. And this is according to Bach et al. In 2017.
One topic that is very near and dear to my heart, as I work with a lot of transgender young people, is that transgender adults are 9 times more likely to attempt suicide at some point in their life compared to the general population. And what we know is that having social support is a big protective factor, protects against suicide. And for young trans kids, having a supportive adult reduces their risk of suicide. So we like to bring that up just to say, and I don't think our audience is necessarily a part of this part of society, but there is so much hate and focused hate against transgender people. And that really does lead to people trying to commit or trying to die by suicide. I caught myself because I learned from Eddie, you're not supposed to say commit suicide, it's die by suicide, which is a good learning point too. Something that I'm glad I learned from Eddie. But yeah, so I hope people understand that when they openly, actively hate against transgender people, that causes people to die by suicide. I mean, it increases the rate. So this is not just some political ploy. This is people's lives. These are people, and something that's important to keep in mind.
Yeah, even things. That's why I think I get such a like emotional, like even like physical reaction when people will openly, caregivers will openly be like, oh, I'm not calling them that name, or that's my son, when they identify as a female, like things like that. It's like you are taking the steps, whether you know it or not, or whether you care or not. These people are literally taking the steps for their child to potentially die at some point, because they're making the choice that they are not being supportive of whatever makes them feel comfortable and makes them feel happy. And that part will never make sense to me. I don't get it. It upsets me, and we're gonna keep moving forward with the information, because if not, I'm gonna say something about Ted Cruz, and I don't want to.
It always devolves into Ted Cruz somehow. Some risk factors for suicide. So these are the things that increase your risk for suicide. Like if you've had previous attempts or other suicide attempts, you're more likely to have another one. A history of mental illness, especially things like depression, bipolar disorder, borderline personality disorder. A serious illness such as chronic pain. I've met a lot of people who have chronic pain issues, and they just tell me, like, I wish I would just pass away in my sleep because I'm so tired of being in this pain all the time. Having legal issues and just big stressors is a big risk factor for suicide too. I think that one makes a lot of logical sense. Similar to financial problems. If you're really in over your head financially and you feel like there's no way out, some people think that suicide is a way out. Substance use, addiction, being bullied, loss of relationships, social isolation, and lack to access mental health care.
Yeah, you think about social isolation, like what just happened.
Yeah.
You know what I mean? Like that's, it's tough, man. Just something to acknowledge. Some protective factors, so things that will potentially help somebody not develop thoughts of suicide, not want to act on their thoughts. Things like effective coping skills, being able to identify, like, okay, I'm not doing well. I need to do something, whether that's engaging in self-care, whether that's talking to a trusted adult, whether that's exercising, whatever it is, knowing that there's things that you can do that make you feel better to deal with whatever's coming your way. Another protective factor is having reasons for living. Sometimes that'll be asked to people who are feeling suicidal, of like, what are the things that are important to them? Who are the people, who are the animals, the pets that are kind of counting on them. A strong sense of cultural identity has also been something that's included as a protective factor. Feeling connected to social institutions. This one I want to make a comment. I've probably already mentioned it like 6 times, but there's a CDC report that talked about the youth mental health crisis. And one of the top things to help, I don't want to say reverse, but to help aid in helping our teens and our children who are struggling mentally is school connectedness. So if you feel connected to school, you're more likely to show up. You're more likely to engage in hopefully positive relationships. You have those positive relationships, you know where to get help. All these good things. So if you feel some type of connection, whether it's work, whether it's school, a church, we'll talk about religiousness here in a little bit, but like these things can be helpful in giving you reasons to continue living or feel like you can take on anything that might be considered a stressor. You mentioned it as a risk factor, so the opposite is availability of healthcare is a protective factor. That's very important. I think that's why for me it's so important when I'm trying to help a student and a family find care. I'm looking all over because I know like just getting connected is super important and could be super helpful. And the last piece is religiousness. I think that goes back to the social institution, the spiritual institution. Feeling connected to a higher power has been shown to be really helpful for a lot of people.
Yeah. And to build on that point of social isolation, we have a society that really values social isolation. Our country over these past few decades has moved away from public gatherings, moved away from social events like churches, social clubs like Elks, Kiwanis. Like, people don't, especially this younger generation, they would rather sit in their house and be by themselves. And it's easier that way. It's more comfortable that way. You don't have to force yourself. You don't have to go out. So we're seeing a rise in social anxiety in young people. We're seeing a rise in social isolation. And I think that is one of the biggest factors, one of the driving factors as to why we're having such a bad mental health crisis, why things have been getting worse since the start of the smartphone. I think the smartphone in and of itself, it doesn't foster close connections. It fosters superficial, detached connections. I know that there's a juxtaposition of words there, but I think people are less connected to society, to other people than ever. And if you could boil it down to one factor as to why we're struggling so much with mental health as a country, it's that. We're isolating ourselves. We're not connected anymore.
Yeah, you beat me to it. I watched this guy's TEDx talk about the smartphone and social media addiction and internet addiction. And
was it TEDx Omaha?
Wait. How'd you know?
Sounded familiar.
Yeah, I mean, like you've talked about, like you've taught the world, which Okay, we're gonna stop real quick. Justin's video has a shit ton of views, so please feel free to go check it out. It's pretty dope to see how many thousands of views he has. But yeah, to Justin's point, like, why should I leave the house to go talk to my friends or talk to people when I can sit here on my phone and connect with people that way? I will say though, yes, it is easier to stay home and do so, but takeout.
Oh yeah.
Like, oh man. Like, eating in a restaurant's fine, but doing takeout and coming back home, like, that's pretty nice.
Yeah.
Let's acknowledge that.
That's the thing. I mean, our society is making it so that we can do more and more things at home. We can work at home. We can eat at home. We can have food delivered to us.
True.
We have our groceries delivered. We have everything at home. I've even met a kind of a slew of kids lately who have been doing online school for the past couple of years.
Oh man!
And they maybe leave the house once a week to go like shopping, and they don't really interact with anyone, and their social anxiety is through the roof because how you treat anxiety is forcing yourself to be exposed to the things that make you anxious and won't hurt you. And so many young people are just learning, oh, I can just be at home. But man, there are so many skills involved with being in public that a lot of young people are losing. Yeah.
We also want to remind you all, Justin mentioned it earlier, but there is a new like national suicide hotline, national suicide safety hotline. It used to be this long number that like Logic, the rapper, like had in a song, and then like people kind of said the song was corny, which is beside the fact. I just wanted to mention it. But now it's a quick 3-digit number, just like 911. It's 988. Please, like, if you ever experience thoughts of suicide, feel like you may be having safety concerns, either call 988, go to the nearest emergency department. I think the way 988 works, which is probably how 911 works, is it directs you to like the closest like county small governmental resources there and tries to get you connected with people and places that are near you and hopefully not too much of a barrier to get to.
Yeah, it's a pretty cool resource. Also, I know we talked a little bit about how our society is a little bit sick. Like the things that we value capitalism, we value money, we value items. We're not necessarily valuing connection, people, family. And so the CDC has a few recommendations to prevent suicide on a societal level that I thought was kind of interesting. So improving financial security was a big one, which is tough in the United States as wealth inequality has exploded. And a lot of people, what Bernie Sanders gives the statistic all the time of 80% of Americans can't afford a $500 payment, a surprise $500 payment. So that is stressful. In and of itself, financial insecurity can increase your cortisol levels and increase that stress, make you more likely to develop mental health problems and increase your risk for suicide. So I think if we want to fix this, we have to fix it at a societal level. Other things that you can do are reducing access to lethal means. We live in the country with the most guns per capita. And I know that, guns don't kill people, people kill people. But when you have guns everywhere and it's so easy to get your hands on them, that does increase the risk of people dying by suicide. Governmental policies to improve access to care, increase the number of providers. Those are some other factors that can help reduce suicide. And teaching coping mechanisms and problem solving in skills, which you're in a school, Eddie. Like, are kids taught that these days in school, or at least in Oregon?
I think there's for someone who's not in the like public education like field, right? There's this thing that's been pushed over the last few years called like social emotional learning. And I think that the core of that is to like be better in tune with like your emotions and like the people around you and like how to function. I think there is like a push to teach more coping skills and to talk about that kind of thing. I, for one, go to all the health classes and give a talk about like self-care. And then I also talk about like internet and social media use. I think what I've seen and I'm only talking about my school, but over the last few years, just like different organizations on campus or clubs wanting to promote certain like wellness topics. So I think there is at least a little bit of a push from like a Department of Education thing. It probably varies state to state, but I think I mean, if there's one thing that I will say, there's a specific group of people who like freak out about certain topics in schools. One of them recently, there's been an attack on social emotional learning. So my guess is it is a nationwide thing that they're trying to bring to schools.
Good. Needs to happen.
Yeah.
And
Yeah.
I think that's a little bit more important than calculus. But that's just me as a psychiatrist. Some discussion questions. I know we talked a little bit about how you shouldn't use the phrase committing suicide. Because, I mean, if you think about it, like, yeah, it's using a legal term to describe, like, a mental health tragedy. But what other language? Like, how should we talk about this? Any other things that you would avoid saying? What do you think, Eddie?
Yeah, I think describing a situation where someone has passed away following an attempt, you can describe it as died by suicide. I noticed on the news that they've started to do that more. Like they say, like this person died by suicide instead of like commit. So I think that's really helpful and I guess cool. I think that's okay to say. When talking about suicide with people, saying directly like, are you thinking about suicide? Are you having suicidal thoughts? You can also say things like, this is a little more not as direct, but are you having safety concerns? That can help open the door to, if someone says yes, tell me about them. Are you having suicidal thoughts? Are you having plans? Like that kind of thing. I think the more direct, the better. Like we've talked about, I think people who are struggling, people who are hurting, sometimes don't know the way to bring it up or how to say it directly. So if we can take the directness part and do it ourselves, I think that helps people a ton.
Yeah, I think you're absolutely right. What is your experience with working with those who are struggling with suicidal thoughts? Like, as someone who works in healthcare, mental health, like, what do you think? Like, what's the hardest part?
I think the hard part is having teens who have never said anything to their parents. So like now, like, what do you mean? Like, do you have to tell my parents? Like, yeah, like my biggest thing is I just want to make sure you're okay. Like I need an adult to know, especially someone that's going to look after you. People worry that they're going to be, I guess we just said not to use the word, but it is a legal word. So committed to like a hospital, committed to, involuntarily held. They worry about that. And I think I can never guarantee that will never happen to someone who's having suicidal thoughts. I will say there's a lot of steps to get to that point. So I think the more that someone is able to like try to get help and be open and receptive to help, that can hopefully help avoid that kind of situation. But I think people would just end up being really scared to say something because they don't want to feel like something's wrong with them or like they did something wrong. They don't want to feel like they're disappointing people. Like, oh, please don't tell my parents. Like, I don't want them to be upset or worried. Like, I think we're working with a group of kids now who would rather take the brunt of everything than to pass it on to other people. So they're more willing to keep things to themselves to not worry others. And I think that's one thing we definitely need to move away from. But what's your experience been like?
Yeah, I got to say the hardest thing for me is I've had to send kids to the emergency room. Usually if you see someone in an outpatient clinic and they're having suicidal thoughts and they don't want to go to the hospital, you have to send them to the emergency room first. And I hate our process because I wish I could just get them right into the psych hospital, but oftentimes the psych hospitals are full. So there's been cases where I've sent kids to the emergency room and they sit in there for days waiting to get into a psych hospital. Here I am telling this kid, I think this is what's best for you. And then they sit in the emergency room for 3 days. And it's like, okay, I feel like I lied to them because sitting in the ED is not good for anyone. And so our process just kind of sucks in this country. And a lot of kids end up, I've seen kids spend a week in the emergency room just waiting to get into a psych hospital, waiting for a bed to open up. So that's the thing that bothers me the most as a psychiatrist. I wish there were more resources. I wish we could get kids into psych hospitals sooner. I wish we didn't have to send them to a standard emergency room, because I've even sent young people who are actively suicidal to the emergency room, And then they go in there and they tell the ED doc, like, oh, yeah, like, I'm totally fine. I'm not having suicidal thoughts. And then they get discharged from the ED. And then I call and I'm like, hey, where's that patient? And they're like, oh, we let him go. They were cool. Cool guy. And it's just like, come on. I sent you them specifically. I sent you notes. I talked to the charge nurse. Sorry, this is my frustration coming out with the system where it doesn't work great. And every hospital is different in terms of their process for getting kids into the hospital. And it's never that good.
Yeah, I mean, there's been times when I was in the crisis team where like I'd be in the emergency department and like just seeing like all the phones ringing, like people coming in, like firefighters, EMTs, paramedics, like there's just chaos the whole time. So it's like we wish they'd be able to keep track of patients we send or notes we send and things like that, but then it's like, how are they supposed to with all this stuff going on? Like, you're right, like it's wild. It's a mess.
It's a mess. Unfortunately, the ED has to just like pick up the slack for all the other failing social services in this country. Yeah,
absolutely. What about when talking to a peer? I've already mentioned like it can be hard and it can be difficult, but like if you're able to support somebody, like please do, to the best of your abilities. But like, what can we do? What can someone who's listening do to help a peer who's struggling?
I would say my number one advice would be to use open questions. Start off with like, what's going on? What are you struggling with? Tell me what you're dealing with. Like, I want to help. I want to listen. And then listen as much as you can. Talk the least amount possible. Don't interrupt them. I think as a whole, man, I'm really negative on our society tonight. I'm a very optimistic person, but our society doesn't do a very good job of listening. Like, if you listen to most conversations, people are constantly interrupting with each other, talking over each other. If someone is feeling suicidal and someone butts in and goes, oh, well, your life isn't that bad. Like, you're not doing that bad. You're not feeling suicidal, right? What are they going to do? What's their reaction going to be? They're going to shut down. They're not going to open up to that person. They're going to keep it all inside and bottle it all up. So listen, be direct, be empathetic, don't interrupt, and just try and be there for that person.
Yeah, there's a lot of listening to just give a quick answer and not so much to listen to like support and like express empathy and I feel you.
Any other tips on helping people, helping peers?
I think like we've talked about already, just being direct, letting them know that you're there for them. I think sometimes people just will assume that they're by themselves. They don't have other people there to support them. So I know it could be really helpful for someone to hear directly from their support people, like, I'm not upset. I'm just here for you. Like, let's talk this out.
Yeah, that's a big one. Because I think people have the expectation, because even going back to the phrase committing suicide, it's a double whammy. You're not only breaking the law, you're doing something like, there's so much wrapped up in this, and I think people feel that they shouldn't have these thoughts. They need to hide these thoughts. So just being open and supportive and saying, like, how can, the focus, the intent of how can we get you help, instead of like, how can we invalidate your feelings and tell you that you're fine.
Yeah. How can exactly? Yeah. How can we help you see the bright side? I hate that. Yeah.
This is the point. This is the mark.
Yeah. Well, thank you everyone for listening to this newest episode. Thank you all for rocking with us this long. We're hitting episode 100 with our next one. We hope this was helpful, whether for you or somebody you know. We just want the information to be out there. Wherever you get your podcasts, you know where to find us on Apple Podcasts, Spotify, all the other things. You'll find us on Apple Podcasts. If you'd like to, feel free to leave us a 5-star review, and you can leave us a note. We got one recently, which is really nice, and we also got one on Spotify the other day. You can do the same thing. You can leave a 5-star review, or you can leave a question or an answer. Give us some thoughts on our latest episode. We'd love to hear from you. On social media, you can find us at MillennialMHC, and that's on everything, at TikTok, Instagram, Twitter, YouTube. I'm going to mention Threads again, but nobody uses Threads anymore. That was cool for like 2 days. Thank you all for listening. Thank you all for supporting.